Hi everyone, welcome back to my channel. So today I wanted to talk about a very specific topic, and that is going to the dentist while chronically ill. Now, if you're like me, you hate going to the dentist. I do not like going to the dentist. I recently had a situation where I badly needed dental work. I'm missing like almost half of a molar back here with a molar that's all the way in the back. And we finally got insurance approval for it. If you have Medicare or Medicaid, it's very difficult to get insurance approval for dental work. And so this tooth has actually been falling apart for a long time. Fortunately, I'm not in pain, but I knew that either at some point I was going to have the tooth removed if I didn't get approved to get work done on it. And so finally, my dentist got insurance approval, and I needed a crown, a buildup in a crown, because again I was missing like half the tooth. Unfortunately, the week that I was scheduled to get the work done, I got a sinus infection. The sinus infection wasn't that severe, so I went to the dentist only to find out that he was not going to do the work. So my first tip to you in going to the dentist is do not go to the dentist if you have or even suspect that you have any kind of infection up here in your head area. So eye infection, ears, sinus, don't do it. That had never happened before. And again, my infection wasn't that severe, but he refused to do the work. And I was very upset about that and literally had to reschedule like a month later. So that's tip number one. But, I think the aggravating part of all of that was that I was actually having a decent day health wise, in spite of the sinus infection. And, my stomach was feeling okay. That's been my primary source of issues. It's my stomach. And so I was kind of upset that he didn't do the work because I was actually having a decent day. So on top of the fact that I have a lot of dental related anxiety, I have always been someone that does not like going to the dentist. It's always caused a lot of stress for me. And, on top, if you have a chronic illness on top of all of that, it just makes things 10 times worse. So that's kind of what inspired this video, because I know I'm not the only one. I know that I'm not the only person that deals with this. I'm pretty sure there are a lot of you out there that not only have a chronic illness, but deal with a lot of dentist-related anxiety. And so I kind of wanted to do this video to give some of the tips, tricks that I use in order to kind of get through a dental appointment. So the first one that I wanted to talk about, especially if you deal with things like nausea and stomach issues, is C-bands. I'm pretty sure I've talked about these in another one of my videos. These are kind of old. I badly need to get a new pair. These are actually the child size because my wrist is so small. I had to get the child size. You put them on your wrist. They press on a pressure point for nausea. And so they help to calm nausea. And the reason why I like these is that I can hide them under a long sleeve, but also it's not something that goes in my mouth. And obviously, if you're on your way to the dentist, you can't really eat anything. You can't put like a ginger chew or anything like that. I don't do well with medications like Zofran, which is used for nausea. It causes like really bad constipation for me. But if that works for you, you can take a Zofran. But you also have to check with your dentist and make sure that it doesn't interfere with, anything that they might give you there. For example, with me, they had to inject me with that, whatever numbs the nerve, because they were going to be doing a lot of work on that tooth. So I'm always very apprehensive about taking any kind of medication in case it interacts with whatever they're giving me there. So C-bands are, something that have helped me quite a bit. If you do need something to put in your mouth, these tablets are pretty good. They're called Ginger Rescue. They're really hard to come by though. I don't know if they've been discontinued, but I was able to find them on eBay. You can put one of these tablets and just dissolve it in your mouth. Don't chew it, because if you're going to the dentist, obviously you don't want to get stuff all over your teeth. So this one you can just dissolve in your mouth little by little, and it gives you ginger, and it can help to calm some nausea if you do suffer with nausea or any kind of stomach issue. So that could help. You could also do ginger tea, but again, if there's any kind of remnants of like the herb or whatever, you can get it in your teeth. And obviously, if you're going to the dentist, unless you're going for a cleaning, I guess they could clean it off. But if you're getting work done, the last thing you want to do is have to have them clean out your mouth all over again just so that they could start doing the work. Another thing that I use, because I do have light sensitivity issues and I have addressed this on this channel, is an eye mask. So I have this little eye mask that comes in this little thing. This is an old one, actually. I have gotten a newer one for sleeping. But when you go to the dentist, they have the light like directly pointed at your face because they're trying to see inside your mouth. They do give me sunglasses at the dentist, but I'm telling you right now, sunglasses don't cut it for me. So I take a whole eye mask. This one, like I said, it's old, it's all stretched out, but I put the eye mask on. It completely blacks out the light. And sometimes this can also help with stress. That way I'm not looking at the tools. I'm not looking at what they're, pointing at me, so that can help with some of the anxiety. If you're the type of person that just doesn't like to see what's going on, that can help. But for me, it's more light related. I just don't like having, on top of the fluorescent lights that are usually in dental offices, they point a light, typically like an LED type of light, directly into your face. And that can be pretty uncomfortable if you have any kind of light sensitivity. So an eye mask, particularly like a little packable eye mask like this one, can work. So this one, I just keep it in my purse since I already have a new one for sleeping. Another thing that I try to do is I try to breathe because I forget to breathe. Obviously, they're in your mouth and that's not pleasant, but I notice that I start holding my breath. So I try to remember to at least breathe through my nose. Take a deep breath and let it out every now and then. So, so I know that I'm getting oxygen, and it does help to release some of that tension, while they're in there. Another thing I notice that I do is that I clench my hands. You usually have your hands like in your lap because they've got you laying back. And I notice I start clenching my hands. So when I notice that, I just gently release. You will start clenching again, which is fine. Just remember to release, and relax a little bit every time you notice that you're clenching your hands. And that has actually kind of helped me because it helps me focus on something else. It helps me to focus on the clenching of the hands. And so it'll take the focus off of like what they're doing in my mouth when I'm focusing. And also too, if you clench in other places, like in your shoulders, or if you're, you notice you're clenching in your abs, just learn to release that. If you're noticing that you're tightening anywhere, learn to release it in the different parts of your body. So you can practice that. I think it's called like it's a type of relaxation technique, and it's used to help you relieve stress. You can do that at the dentist, especially if you're someone that gets very tense. Wherever you notice the tension, if it's in your feet, in your legs, just try to let it go and relax. You will eventually tense back up, but just relax it as soon as you notice that you're tensing back up. Like I said, try to schedule on your good days. Yes, that may be hard for some of us, but like I said, if you're dealing with some kind of an infection, especially in your head area, do not schedule. If you're taking some kind of a medication, an antibiotic or something, do not schedule. I learned my lesson the hard way because they sent me home. I had to drive 45 minutes home and I was not happy about that. So try to schedule on your best day if that is possible. Try to find a good dentist. This one is a tough one. The dentist that I have now is great. He's probably one of the best dentists I've ever had. He does really good work. He's very patient. And I actually found him by accident because I was going to a dentist in this same office, and I think he sold his practice. And so this guy came in and he actually was better than the last guy. And so I just stayed. They took my insurance. I stayed, and I have been very, very happy with him. He's done a lot of work. He's very patient. He's very calm. Definitely try to find a dentist that matches your personality. If you are someone that needs a lot of hand holding, a lot of soothing, then you need to find a dentist that is calm and that is soothing and that is, somebody that will baby you a little bit. Some people don't like that. Some people want a dentist that can work fast and do the work well. And maybe you don't care about their personality. As long as they can do the work and do it quickly, and you're in and out. So you got to find the right fit personality wise if your insurance allows for it. Now, there's this other thing, for those of you that have a difficult time having a good day and scheduling on a good day. I did this once, and this was many years ago when I was still living with my husband in an apartment. I had a dental hygienist come to me for a cleaning, and I believe I didn't have insurance at the time, and it cost me about $100. This was a while ago, so it might be more expensive now. But I had a dental hygienist come to our apartment. So there are mobile dental hygienists that can come to your home and at least do a cleaning at home. Obviously, when it comes to doing work like fillings, crowns, things like that, you probably have to go into. Actually, no, I think you can. I think there are mobile dentists as well, but that is obviously more expensive. I don't know if insurance covers that or how much insurance would cover. I think it would depend on your diagnosis and your health. But a dental hygienist, there are mobile dental hygienists. It cost me about $100. That was many years ago. It probably costs more now. But if you are someone that has a very difficult time, you do not have good days, I would recommend that if you can afford it. And I did it once and I actually really liked it because I think we did it on like the couch. Like they just laid me back on the couch and she has her own little thing, her own little setup. And she did a really good job. I remember my teeth feeling like really clean afterwards. And I've always wanted to do it again because, the insurance that I have only covers one cleaning a year. And so I've wanted to have somebody come and do my cleaning. And just because it was nice to have it done at home, I don't have to deal with lighting. I don't have to deal with, being stressed out and like, being in an environment that I'm not accustomed to. And it was great. It was almost like luxurious to me. But again, it can get expensive. And you would have to find a mobile dentist or dental hygienist. And again, depending on the work that you need done, I'm not 100% sure if an actual dentist can come to your home. But those are my tips. If you guys have any other tips, by the way, like anything that you do to cope with going to the dentist, because I know I'm not the only one that does not like going to the dentist. If you have any other tips, please leave them below because I would love to know. I have always had this issue, and the worst part is that I have always had very bad teeth. I have many fillings. I have had to have almost all my fillings redone at this point. So, I've had just a lifetime of dentistry being in and out of the dentist. And it's one of the things that I hate the most in this world. I am so nervous and so stressed out when I go to dentist. When I go to the dentist, I am a difficult patient as well. And so any tips that you guys have, anything that you do to help yourself when you go to the dentist. And also, if you're chronically ill and there's something that you do to help with your health issues while you're at the dentist, please let us know down below. I think this is more common than people know. And I would really like your help. So thank you so much for watching. Please like and subscribe, and I will see you in the next one. Take care.